the Cape MD. That's C, the number 4, P, EMD. We are 4 female physicians. Obviously, we're melanated, and our purpose is to, with Rolling Out and Munson Sneed and Portia, thank you for having us, is to communicate information that is pertinent to people who look like us, that will give you information on how health issues present in us, as well as how to find treatment and how to cope with these different illnesses that occur at high prevalence within our community. So I know everybody is gearing up for that awesome presidential debate tonight. But in the interim, you are stuck with the 4 of us. I am Dr. Lakeysha. I hail from Charlotte, North Carolina. I'll let my other 3 colleagues introduce themselves.
Hi, my name is Amber Brooks, and I am an anesthesiologist and pain physician in the Winston-Salem area. And I want to thank the hosts of Rolling Out for having us tonight. And hopefully we'll have some really interesting discussion about a really important topic in our community, which is breast cancer.
Hi, everyone. I am Dr. Kristen. I am also from the Charlotte, North Carolina area. I am coming to you tonight from Albany, New York, where I practice as an anesthesiologist. Thank you again to Rolling Out for having us tonight, and we look forward to sharing some good information with you all.
All right, I guess I'm last today. I'm Dr. Tamika Dawson-Knox. I am coming from Indianapolis, Indiana, and I am a family medicine and sports medicine physician, as well as an IU School of Medicine faculty member who is a course director. So welcome.
Welcome, welcome. All right, so this is the squad, people. Again, thank you to Rolling Out, thank you to Munson Sneed, and thank you to Portia for allowing us to host today's Health IQ with you. Today's topic is breast cancer, all things breast cancer with respect to diagnosis, with respect to treatment, but more importantly, with respect to the prevalence within our community and how we deal with breast cancer. So before I get started, I just want to say again, the 4 of us collectively, we're known as the Cape MD. We have a YouTube channel. Follow us at the youtube.com/the Cape MD. That's C4PEMD. And we're currently getting ready to bring our audience a platform television show where we talk about all health issues about us, for us, how it presents in us, and more importantly, how we get treatment for it. So without further ado, ladies, how many of us know someone personally in our family or a close friend who has either diagnosed with breast cancer or has succumbed to that diagnosis? Wow, look at that, y'all, 100%. Okay, I'm gonna dial it back a little bit. How many of us know someone who perhaps has found breast cancer early via a lump in their breast by doing self-breast examinations, and they've avoided a long-term diagnosis? Okay, so that's 75%, y'all. So Dr. Tamika or Dr. Amber or Dr. Kristen, do you guys want to talk about the prevention of breast cancer and the importance of a mammogram?
So I'll take this one. So since I'm a family medicine and sports medicine doctor, I tend to see a lot of primary care in my office. And the biggest concern right now is that because of COVID-19, people aren't coming to the office. So the greatest concern is, if you're not coming to the office, are you getting the screenings that you still need, even though it's COVID? And so my thing with patients is to still do what you need to do to take care of yourself. So still go get the screening, still continue to actually go to your primary care doctor, whether that be virtual, phone call, to make sure you're still getting your mammograms, because the concern is that if you're not, especially in our community, we're more likely to have more aggressive cancer. So I'll give a situation which I know I've already gotten permission from a patient to share this. in the fact that, 6 months before her diagnosis, she had a normal mammogram. She found a lump. Her mother had breast cancer. She found a lump. Her mother and her best friend had breast cancer. And she was like, oh, it's probably no big deal. 6 months before. Okay. So imagine this is COVID times. And so 6 months before was what, February, March. And so 6 months before, no big deal. Like, I can wait another year. My mammogram's coming up this next year in 2021. No, she had stage 0 breast cancer from that small little lump that she found herself. And so the big thing is, do not think that just because you had a mammogram 6-7 months ago, that lump is okay. No lump that you feel in your body is okay, especially with a family history. And so even though you had a mammogram 6 months ago and you were like, oh, I probably don't have breast cancer, the biggest thing is to make sure that you are going to get your screening. And if you are concerned, then I am concerned, and your physician should be concerned. And so, yes, it's COVID. Yes, we have to be careful. Everyone's going to wear a mask. Go to your doctor and get screened. Get your mammogram. I'm also talking to myself, who has not gotten her mammogram in 2020. So I'm going soon. I already got my order to get my own mammogram.
Right. The key is to catch it early.
Yeah, Dr. Tamika, you bring up a really important topic around early detection and self-examinations. And that's why it's really important for you to be comfortable with your breast tissue, to know what lumps you have in your breast during the time of menstruating, if you are menstruating, and outside of the time that you're not on your period, because breasts tend to change around the time of your period. So that's why it's really important to be comfortable and know your body. No one knows your body like you know your body.
Exactly. So real talk, because we bring information authentically using our own stories. How many of us, 4 doctors, do self-breast exams on, I'm just going to say, a quarterly basis? Dr. Amber, Dr. Kristen! What? Okay.
I'm going to keep it real. And,
do you see, America, even physicians are bad patients?
Yeah, I'm going to keep it real. And, so interestingly enough, I had my first mammogram last year. I turned 40, and shortly thereafter had my first mammogram. And, it wasn't as bad of an experience as I think I hyped it up in my mind. The mammogram tech who was doing my exam was very gentle, very compassionate, very, very patient with me and my questions and concerns. So get this, I don't have any to share this with you all. About a week later, my results come back, and there's questions about a potential calcification versus other type of mass. And that's all the information that I was told. And I was told that I needed to come back in for a follow-up ultrasound to better characterize this small mass that could be benign or a calcification. So long story short, it turned out to be okay, but I'm not gonna lie, I was sweating bullets in that ultrasound. I'm thinking, what if? And again, this is a perfect example, because again, I have shared this story with no one, but I think it's a perfect example of how, especially as Black women, we, you're like, we're going to carry our own burdens. We're not going to discuss private matters with other people. We just kind of struggle alone, or sometimes struggle in silence. But it was, I'm not gonna lie, it was kind of a scary time. And I was, praising Jesus when the ultrasound results came back and it showed that it was, a normal fatty tissue.
Wow. So after the show, audience, just for your FYI, we're going to beat Amber because she knows better than not to tell her tribe. But let's dial it back. Let's break it down for our viewers. So who wants to talk about how frequently you should be doing breast exams, and who wants to go over how you do a breast exam. Let's just keep it real. We all have clothes on. You don't have to, actually touch your body, but let's go through how you do a breast exam.
So the new recommendation is actually that unless you're doing self breast exams all the time, then you shouldn't do them. So essentially, if you're not touching your breast monthly or at least quarterly, then the breast exam is essentially worthless. We all have lumps and bumps in our breast. And so by saying, hey, I'm going to do this, you're going to continue to do this, because you may feel a lump that's been there for 6 months. And if you're only doing it sporadically every year to 2 years, that lump might have been there. And so you're not really going to see a change. You're not going to really see the difference. But if you are really, checking your breast monthly or every 2 to 3 months, then yes, you are going to see a change in your breast and you are going to notice a difference. And so that's the biggest thing, is that the new recommendations don't necessarily say you have to do a breast exam. However, if you're going to do them on yourself, you want to keep it pretty regular and not be kind of this sporadic every year to 2 years you're doing your breast exam. On top of that, if you're doing a breast exam, anything that moves or you can kind of move it is a great thing. That's wonderful. It's more than likely a cyst, or you probably have dense breast. Anytime you have something that like sticks on you or hard to move, those are the ones you should be concerned about. Regardless, you still need your mammogram, especially if you're African American, every year, at least every 2 years, because you do not want to miss that small little lump that could be a 0 when it's staged at first, because guess what? You have the best chance of surviving that and the best chance of not having chemo. And no one really wants to have chemo. It has its own set of side effects. And so the sooner you find something, the better.
So who wants to demonstrate a breast exam? Let's just get down and dirty, y'all. Oh, come on, don't be shy. Dr. Kristen, let's talk about the 4 quadrants.
I was just going to say, considering that I don't do them regularly, I don't think I'm the best one to demonstrate.
Dr. Tamika, take it away.
All right, so here you go, guys. So I always say start outer, go in, come back out. So if I'm doing it on you, I'm going to start kind of here, and then I'm going to kind of go around, and I'm not going to lift my hand. I'm also going to press on your nipples to make sure you do not have discharge, because if you do, that's a concern as well. You shouldn't, if you're not breastfeeding, you should not all of a sudden have discharge. But the biggest thing is you want to try not to move your hand from your breast, because if you move your hand, you're going to miss something. The other part is you want to make sure you get underneath your arms. So you want to make sure that you are at least getting underneath your arms so you can feel any lumps or bumps there, because sometimes the most concerning lumps are kind of in this area. And so if you're not getting underneath your axilla, or at least until that upper quadrant, you could miss something that's concerning. And so making sure you kind of touch every aspect. The other part is you don't want to do this while you're on your period. So if you're on your menstrual period, do not do a breast exam. It's going to be more tender, especially if you're on your period or about to come on your period. I always tell women, do it 2 weeks after. So try to do your breast exams about 2 weeks after your menstrual period. You're more likely to feel what you need to feel, and it's not painful, because when you're about to come on your period, you guys already know we're moody, we're not feeling it. And so if you're doing it around that time, you're not going to want to do it, and it's going to be more painful. So then you're going to have more concerns because it's more painful, because it's around your menstrual period to begin with.
So Dr. Tamika, if I'm in the shower, like, how should I be?
So if you're in the shower, I always say you should have like one arm up and then use your other arm to kind of touch on your boob. So go around, circular motion, then touch on your nipple, make sure you don't have any discharge, and then kind of go up. And then once you're done with one side, you want to do the other side. So lifting that breast, and you want to make sure your breasts are lifted at the same kind of diagonal. So you want to make sure they're lifting about the same, because if one is off normal than off compared to the other, then you might be more concerned, especially if it's not normally like that. Some people have one breast that is way larger than the other, and that can be normal for that person. However, if that's something new, then that's something we are concerned about.
That's awesome. Dr. Kristen, what do you think are some of the kind of misconceptions or just, maybe inaccurate thoughts about breast cancer and mammograms and just the self-exam itself within the African-American community?
Well, I definitely think that just in the population in general, I think people do forget that men can get breast cancer. It's definitely much, much, much less common in men. I believe only 1% of all breast cancer cases are men. And I think only 1 in 1,000 men will be diagnosed with breast cancer. So it's very rare, but let's just keep that in mind as well. And then for women specifically in communities of color or the Black community specifically, while our incidence of breast cancer may be slightly lower, we actually have a higher mortality. We are more likely to die of breast cancer once it's diagnosed. So that's just something that we all need to keep in mind. Like Dr. Tamika said, we need to be getting our mammograms, and correct me if I'm wrong, Dr. Tamika, we need to start, I believe at age 40, you have the choice of getting it every year. And then by 45, we should definitely be getting them every year. And correct me if I'm wrong on that, Dr. Tamika. So we definitely need to get our screening. And breast cancer can be genetic. And I think when it comes to being what people call triple negative when it comes to breast cancer, that's something that we can definitely talk a little bit more about. That's actually more common among Black women. We are less likely to have like HER2 positive breast cancer. And those cancers are actually easier to treat. So the triple negative ones are more aggressive and they're more difficult to treat. So those are the things that we just need to be aware of, and it's why it's so important for us to get our screening on a regular basis.
That's good. So let's say, you have a friend or relative who has breast cancer and is going through treatment of either chemotherapy or radiation, or quite possibly has opted for surgical mastectomy, or in some cases, a proactive double mastectomy. Can we talk a little bit, ladies, about how you can support a friend or family member through that? And also, can we talk a little bit about the benefit or lack thereof of being proactive and getting a double mastectomy?
So I think that that's a hard decision in general when a woman knows that they have a huge family history of any kind of cancers. My grandmother had colon cancer, my aunt had ovarian cancer, so I'm at increased risk of breast cancer. And so have I considered getting genetic testing? Absolutely. But that also comes with its own set of risks. So for instance, if I get genetic testing, I have 2 young sons. So I am more likely not to be able to get life insurance. So what does that do for my kids if I am at increased risk? I'm at like a 30% chance, a 30% increased risk because of their cancers to get breast cancer. So you got to be really mindful before you go in and say, oh, I'm going to get genetic testing, because that puts you at an increased risk for life insurance, which is a whole nother situation and we'll talk about later. But on top of that, how can we support each other? And I think the biggest thing is that you should go to these doctor's appointments with your friends. If your friend does not have anybody to go with them, go with them. Offer to go with them. Why? They're not going to remember these questions. They're not going to remember the answer to those questions.
Right.
All they hear is that they have cancer. Cancer, cancer, cancer. I'm going to die, because when they think cancer, most people think death. So if you go with them, if you ask the questions, ask them before you go to the appointment, hey, what are you most concerned about? What do you want to keep? if you were to have a double mastectomy, what do you want to keep? And a big thing is going to be, they're going to want to keep their nipples. Honestly, women get aroused by their nipples, so they're going to want to actually keep their nipples and that sensation. And so you want to make sure, if when you go to that appointment with your friend, that they understand, hey, you know, she's probably not going to remember this, but she does want to keep that sensation. 9 times out of 10, that surgeon is going to listen to you. If there is something that's going to prevent them from doing that, they're going to tell you. The surgeon is not going to say, oh, we're just going to take everything. We don't care what you think. Surgeons are there to help you, guide you through this process. Choose someone that you trust. If you're going to be getting something that is a lifelong decision, you want to make sure you trust that provider and make sure you are asking all the questions you want. And if you don't feel comfortable, get it a second opinion. There is nothing stopping you from doing that. And so as a friend, your biggest thing is to advocate for your friend. And so just try to be there, supportive, and try to be as close to them as possible. And if they have a husband or a spouse that can't be there, husband, wife, or spouse that they can't be there, try to be there for them as well and say, hey, these are the questions and the concerns she has. Make sure you ask the doctor about that, because that's what she's worried about.
That's really good, Dr. Tamika. Yeah.
So just to kind of piggyback on what Dr. Tamika was saying, you know, there are studies that show that under the best circumstances, so, you know, when you're just going in for a routine office visit, that you remember about 10% on average of what your provider or your physician, your healthcare provider or your physician told you. And so you can imagine how much you may remember under significantly stressful situations like a diagnosis of cancer. So I totally agree with everything that Dr. Tamika said about having an advocate to go with you. And, you know, sometimes if you don't have family or friends nearby, oftentimes, especially at academic institutions, there are support groups that you can tap into that are offered by the hospital services. So definitely inquire about support services through your healthcare provider. And, you know, now that we've had such an increased presence on the internet, the American Cancer Society is a great online resource. And they have a wealth of information and services.
Yeah. You know, one thing I want to bring up that's prevalent in communities of color is 2 things. One is fear-based decisions. So the reason I bring up fear-based decisions is because sometimes we can be so fearful of the possibility of cancer that it prevents us from actually getting a screening exam, whether that's a mammogram or whether that's colonoscopy for colon cancer. So don't be so afraid of the what ifs that you don't take responsibility for your own health and go ahead and get the screening, because if it's something that could be found early, then you can do something about it, as opposed to allowing fear to be the motivating factor behind your actions or lack thereof. Then quite possibly that's when the late diagnoses take place. And quite possibly that is why Black women have and women of color have a higher incidence of mortality or death related to cancer. And so I know we're in the midst of COVID-19, but again, be proactive, put your mask on, go get your mammogram, get your screening, get your peace of mind, or get your information, arm yourself accordingly. And like Dr. Tamika and Dr. Amber said, second and third opinions are okay. It's okay. Physicians are human. We can make mistakes too. If you're not comfortable with the first person, if you don't like how they talk to you or their bedside manner, then go to the second physician, but also have an open mind to the information that they're giving you as well. I know we can pray about it, but as my best girlfriend in a master's program used to say, she's a breast surgeon. Shout out to Dr. Monet Bowling in Indianapolis, Indiana. If anybody needs a breast surgeon, she is the woman to go to in Indianapolis, Indiana.
Absolutely.
She will tell you that, yes, you can pray about it. Yes, you can try to pray it away, but the good Lord gave her the tenacity and the intellect to cut it out. Okay. So we pray about it, but you get it cut out too. All right. Any other sort of words of wisdom that perhaps you would tell a best friend who's nervous about her first mammogram? Why don't we walk the people through what a good old mammogram is like?
Yeah, y'all tell me.
Well, Dr. Kristen is probably a little too young to do this. A little. You almost there. You almost there. So my first mammogram experience, I actually had some issues. So I was 40, but I also was having like breast pain. And so my first mammogram was a diagnostic mammogram. And one of the things you want to do is feel comfortable, one, with your doctor to say, hey, I'm having issues. Like, yeah, this isn't normal. And so my doctor, thankfully, is someone I'm very close to and is also a coworker who was like, you got to get a mammogram. And I was like, I'm all right. I don't want to get a mammogram. He's like, no, you should definitely. I'm the worst. Again, doctors are the worst patients. So are nurses. So we do not always take care of ourselves. So I ended up going and getting a diagnostic mammogram. Well, what's the difference between a diagnostic and just a screening mammogram? Well, a diagnostic is they do more cuts to see more issues. Well, when I got there, the lady was like, well, you could also do a 3D mammogram. And I was like, what is a 3D mammogram?
Right.
So again, a different test. And they were like, well, it's newer and your insurance may not cover it. It's probably about $300, but it's better for dense breasts. Well, guess who has dense breasts? African-American patients have dense breasts. My mother, thankfully, my mother talks to me about these type of things all the time, has very dense breasts. So I was like, well, that's probably better for me. And she was like, well, they don't squeeze your breasts as much and they do kind of like thinner cuts. So I got the 3D mammogram. I was blessed. I did it right down the street from my house. The radiologist came and said, your mammogram looks perfect. It looks good, but you need to do yearly mammograms because you absolutely have dense breasts. And so you want to be able to make sure you're investing in yourself. And so I always say, and we always say as the KPMD, health is wealth. And so yes, $300 that I was maybe going to pay out of pocket. Yeah, that's expensive. But what do we spend $300 on, y'all? A lot. We spend $300 like it ain't nothing sometimes. Like, oh, I'm gonna buy them shoes for my son, or I'm gonna go on this trip with my friends. But guess what? In a year from now, if I have breast cancer, I'm not gonna be able to go on that trip with my friends. So let's check ourselves and say, hey, this is important for me. And so for me, that was super important. I'm blessed that Anthem paid, but if they didn't, and I didn't know at the time that they weren't going to, I was like, hey, I'm just going to do this for me because my peace of mind was really super important at that time. Yes, they're going to squeeze your breast. Yes, it's not the most comfortable experience of your life, ladies, but it's worth it. So just make sure that you're doing it. The other aspect of this, and if we're looking at the chat from Facebook is, well, what should men do? Men also are going to have to get mammograms. Sorry, not sorry. You're also going to have to be pushed. And to be honest, men don't have breast tissue like women, so it's even a little bit more uncomfortable, but it'll be fine. They'll do the mammogram, they'll do an ultrasound. It's the same type of experience. But again, peace of mind, health is wealth. The earlier we catch this, the better off you'll be. And so I know it's not the best experience, but it's worth it. And it only takes about 20, 30 minutes. It's not that much of your day to go get this done.
Yeah.
I think you bring up a really good point, Dr. Tamika, the fact that the 3D is a 3D mammogram, not an ultrasound. So the fact that the 3D mammogram is better for denser breast tissue, and the fact that not every insurance will cover that like it will a traditional mammogram. And like you mentioned, the fact that in our communities, we have, or it's more common for us to have denser breast tissue. So for our communities where that may be the better test, I think it's very interesting. And it's, you know, we all know that there are health disparities out there, especially in our communities. And I can see a patient who may need that test, but they are like, I can't pay for it. So I think it's very interesting that that is not covered, especially if you just have denser breast tissue.
It's interesting because I think that, this is very insurance dependent, so it was the same. I had a very similar experience to Dr. Tamika. When I went in, they asked me if I was interested in having this 3D mammogram, and they'd already done what's called prior authorization from my insurance company. And so I knew when I got there, they told me that it was most certainly 100% covered by my insurance. And I didn't even know it was an option until the people at the front desk when I was checking in was telling me about the option. So, again, I think this is our opportunity to share knowledge on this platform. And so we most certainly feel empowered to ask about, speak with your physician about the benefits and of having one type of mammogram versus the 3D mammogram, and going into the mammogram armed with knowledge.
Yeah. I think that brings up a couple of thoughts in my head. The first thing is piggybacking off of being your own advocate. So Dr. Tamika talked about coming into your appointment with a list of questions, because as Dr. Amber said, we remember 10% at best of what our physicians tell us when we go to an appointment. And a lot of times I know, particularly some of our older patients, they feel as if they're being rushed. And so I highly encourage you to come in with your questions written down so you can feel satisfied that they were all addressed. The second point is be your own advocate with respect to knowing your body. Okay, I know sometimes in communities of color, we don't like to talk about things such as breast examinations, touching yourself, being familiar with the breast tissue. We don't like to necessarily have talks about sexual education. So I think that's one thing that generationally we need to kind of break the sort of stigma related to being cognizant about how your own breast tissue feels, the fact that you have to actually touch your breast to know what your breast tissue feels like. Knowing that you have dense breasts should be the same knowledge as knowing what blood type you have. If you don't know the answer to both of those, that's a challenge that the CAPE-MD is actually rolling out to you to find out. And then finally, with respect to the health insurance issue, y'all, if you think your vote in this election does not matter, it matters, because guess what? Not only the presidential election, but your local elections play a role in health insurance coverage. If you are not insured, that also has political ties. So I encourage you to arm yourself with knowledge and actually participate for your own health, for that of your community, and for that of your children, if nothing else.
I will certainly be tuning in tonight and listening to the debates, and very interested to hear where both sides stand on issues around healthcare, because with regards to why there is this gap between mortality in white and Black females or women who get breast cancer, partly stems, it's multifactorial, but part of it is access to healthcare and making sure that you're seeing your doctor on a regular basis. Well, that's much easier if you have healthcare insurance. So again, I'm very interested to hear what the candidates have to say about healthcare. I'll be all ears tonight. I wanted to, circle back around to something that Dr. Tamika shared earlier, which I think really gets to part of holistic health, and that's knowing your family history. And, at least in my family, and it may be like that with others out there, but, sometimes there's secrecy around certain topics. I'm thinking about mental health illness, I'm thinking about substance use. And sometimes, when people are, I've had family members who've had conditions and who suffered silently until the end, and many of us didn't even know. And so, knowing your, if you have the privilege you're not adopted, and you have the privilege of knowing your family history, that's really, really important, especially with breast cancer, because we know that there are certain people who have potential genetic predispositions, like Dr. Tamika was sharing.
And I think it's super important that we force our family, especially our older women and African American women especially, to share those experiences with us. And I know how our mothers feel about all of us and how most mothers feel about their daughters. And you should say, hey, Mom, if I don't know this, I'm at increased risk for having something I have no idea I could have. And so they do not want that for you. And so you got to force them sometimes, because sometimes they don't want to scare you.
Right.
And so you got to make sure your family understands, like, this is important, Mom or Dad,
Right.
I know what Grandma had, what you had, what all our aunts had, because that's what's going to protect me. That's what's going to make sure that in the back of my mind, when I'm like, oh, I don't want to get this mammogram this year, that I force myself to do that, because I'm at increased risk and I know I'm at increased risk.
Right.
And so making sure you know your family history, forcing your mom, talking to them about these things, and not talking to them as because you're nosy or you just want to know. You want to know for your own health. And so you need to make sure that you know these things because of what you're going through and what you could potentially go through. And so we've talked a lot about like prevention and making sure, but I also want to talk about what happens when you get that diagnosis. What happens when you say, oh my God, I have breast cancer? And I want Dr. Lakeysha to kind of talk about that mental toll it takes on you to get that diagnosis and what you need to know to get you through that diagnosis.
Definitely. Well, first off, I just want to make this simple statement, okay? Family secrets can ruin lives. They can take lives, whether it's impacting the mental health of family members or whether it's actually impacting the physical health of family members. Family secrecy can take a toll on someone mentally, the person keeping the secret, and physically. For example, the person who should know about the diagnosis, even if it's 3 or 4 generations back, that's still a genetic connection. The other thing I'd like to point out is just because grandma didn't have breast cancer doesn't mean your risk is 0. For example, if grandma had uterine cancer or ovarian cancer or any type of gynecological cancer, those have genetic connections as well as hormonal connections. So those are things that you would need to know. For example, if, say, your mom had breast cancer or your grandmother had breast cancer, and let's say the doctor recommends a medication that may enhance a certain hormone such as estrogen, i.e., birth control pills, or perhaps if you're a smoker, did you know that being a smoker, if you have a family history, can increase your risk of breast cancer as well as other gynecological cancers? So it's really important to know your history so that you can further be proactive about protecting your health. Now let's fast forward to when you get the diagnosis. What do you do? First of all, life is not over, okay? Second of all, it's okay to fall apart. but temporarily. I always say it's okay to not be okay sometimes. It's natural to have a strong emotional response to such a diagnosis. But it's also natural to want to isolate yourself, and that is the wrong thing to do. You want to have at least one or two people who can continue to put a fingerprint on you, so to speak, who checks in on you all the time to ensure that you are holding up from a mental health standpoint. Notice I said mental health and not mental illness. Any challenging situation in life can lead you down the rabbit hole of anxiety or depression. And the way to prevent that is to arm yourself with a tribe. These ladies are my tribe, which means friends or family members or sisters. And know that with the help of them, whether you have a spiritual belief or a higher belief, whether it's God or whether it's something else, faith is important. Okay. So the two things: a tribe, faith, and then finally, the third thing is knowledge. Arm yourself with information so that you can be proactive about the treatment options. You may be presented with surgery options. You may be presented with chemotherapy. You may be presented with radiation. Well, what the hell are all of those, right? So you want to know what they are, and you want to know what the risk associated with them are. And then you can make what we call an informed decision. And any physician who's not willing to walk you through those, second opinion, y'all. Next. What Beyonce say? To the left, to the left. You know, we got to throw a little humor in it. But I want to say that you can do this. If I'm speaking to somebody out there who already has had the diagnosis, or even if you've had a recurrence, life is not over, okay? I have a very close friend who lost a mother to breast cancer. She lost an aunt to breast cancer, and her sister was diagnosed with breast cancer. And guess what, y'all? She was under tremendous stress herself in terms of her profession. When I tell you that young lady is thriving to this day, she is thriving. And I'm so proud of her. She knows exactly who she is. So I just bring that example up to let y'all know that the diagnosis does not mean life is over. Okay. You just have to switch your focus, do a little pivot, and you keep it moving, but you have to figure out how to keep it moving in a brand new way. So I think, having said that, if there's no sort of last minute tidbits we want to share, I think we should maybe open up the grounds to questions. I'm sure there are a lot of questions, Portia. Any questions out there for us, you guys? We do want to let you know that, you know, we feel a responsibility, not just to ourselves, but to our community, to talk about all health issues, no matter how difficult, or no matter how touchy, or no matter how controversial. We want to ensure that our community understands what's going on with their health and is armed with the accurate information to be able to take care of yourself 100%. Because if you don't take care of yourself, and if you don't value yourself, then you can't expect others around you to do the same. And likewise, we also welcome our platform to majority viewers as well, because it's just as important for you to understand how health issues present in us differently, so that you can understand and relate to us culturally, so that you can help better provide options to our community. And also check your biases at the door. Sometimes biases are just simply ignorance. So when you have the information, then you will be less inclined to make diagnoses based off of assumptions. All right, that's my soapbox.
I have two things. So
Yes.
One, to piggyback on what Dr. Legree said, your mental is really what will get you through your diagnosis. And so making sure you have not only the support system, but if you need mental health services, if you need a group to go to, that there are plenty of groups that you can go to. And I have seen, you know, living in my space, you know, two different groups of women who are like, this is a death sentence and I'm going to die. And they don't do as well as the women who say, I have a support system, I'm going to get through this. So you need to make sure that you were strong enough to get through the diagnosis. And so making sure you keep that support system, making sure you are checking in with yourself and making sure you are doing what you need to do. On the flip side, you may have other diagnoses other than breast cancer. Don't forget about your diabetes and your hypertension and all of those other diagnoses that you have. Don't stop taking those medicines because you have breast cancer. Making sure you're taking care of your chronic conditions as well as your breast cancer will really help. And then we do have one question that I do want to answer, and is, what do you tell your small children? You tell them the truth. You tell them, mommy is getting treatment because I have a disease. And you tell them, because of the treatment that mommy takes, I'm going to lose my hair. And trust me, kids are resilient. If you tell them in the way that they can understand, they're going to bounce back and be fine. But if you ignore them and they're constantly asking you, mommy, what's wrong with your hair? What's wrong? Is something wrong? Then they're going to get worried, and that's going to make the stress on you even worse. One of my neighbors who I'm super close to laughs at me all the time. I tell my kids whatever. If they ask me a question, I give them the honest answer, whether that be a big answer or a small answer. And they stop asking the questions like, how did you do that? I just told them the truth. Tell your kids the truth.
Like magic.
Like magic. They will go away and do whatever. If I say, oh, mommy broke her foot yesterday and now I have to wear a boot. Guess what? Mommy broke her foot yesterday and she has to wear a boot. That's what they think. My young son at 2 had to have surgery and get screws in his arm to fix his forearm and his elbow. Guess what? When people came to him in his cast and was like, oh, you have a broken bone, he would say, no, it's fixed. Because in all honesty, it was fixed. Kids are resilient. That's how they think. He knew that the surgeon told him his arm was fixed. And the people were like, no, it's not fixed because you have a cast. He was like, no, this is just to protect it. Why? Because the surgeon was honest with him. The surgeon said, hey, I fixed your elbow. I fixed your arm, but now you're going to have the cast because it's going to protect you. So at 2, my son knew that that was the answer. Why? Because the surgeon told him the truth. So tell your kids the truth. Your kids will love you, they will support you, and they'll be there for you. And you don't have to also try to hide it from them, because the more you hide from your kids, the more they feel that fear and that anxiety that you have.
Yes. Let me put this disclaimer out there. So we're talking about broken bones in that example. So when you have surgery and the pins are in and the bone is now back together and fixed, yes, that's fixed. That's different from like high blood pressure or diabetes. If you're on a blood pressure medicine or if you're on a diabetes medicine, your diabetes and your high blood pressure is not fixed. You're not cured, okay? If you stop taking the medicine, then that's going to mean that your high blood pressure and your diabetes gets worse. Even while you're on the medication, it just means that you still have high blood pressure and diabetes, but it's well controlled, okay? So I only say that because as an anesthesiologist, when I talk to someone before I take them to the operating room, I can tell kind of what's going on by the medications you take. And so when I say, so ma'am, do you have diabetes? No. Do you have high blood pressure? No. Well, ma'am, I see you're taking insulin. Oh, it's fixed. It's not fixed. Please keep taking your medicine. Thank you.
You're a mess. All right. So the next question is the process for men to self-check the same as women? Y'all want me to take it? Okay.
Yes.
So yes, it's the same. And so the biggest thing is men are not going to normally self-check themselves, okay? But if mom and grandmom and aunt all have breast cancer, then yes, men, you should do what women do, and that's self-check yourself at least quarterly. So 3 to 4 times a year to make sure everything is the same. And like I told you guys earlier, the process is the exact same. And so don't think you have to do anything different, but you want to make sure that you're at least checking your breast at least quarterly, so at least 4 times a year.
So we have another question from our viewers, and someone asked, how can the husband be most helpful if the wife is diagnosed with breast cancer? of course, there are many ways that a husband can show his support and be helpful to his spouse that is diagnosed and being treated for breast cancer. I think that emotional support is just as important as doing more things around the house and doing more for the kids. Those things are absolutely helpful. Your wife will likely be tired from the chemotherapy. She may have other side effects like nausea and vomiting. So doing those physical things, of course, is very important and will be very helpful. But the emotional support is extremely important as well. And yes, it will be great for her to be in a support group with other women going through breast cancer. And of course, she'll have her tribe of women, hopefully in her family. But as her spouse, you play a very important role in just being there for her emotionally. So don't forget that part too. And also just take care of yourself too, because that is a burden on you as well, knowing that your spouse is battling this disease. So just show up for her and just be that person she can lean on, because you're likely her best friend already. So, just having her back and really supporting her emotionally, I think is super important.
So another question is, can getting a myomectomy or a hysterectomy lower or totally negate your risk of developing cancer? And the answer is no. And so do not think that because you have a myomectomy or a hysterectomy that is going to totally negate your risk of having breast cancer. That is not how it works. And actually, if they leave your ovaries in, that doesn't negate anything. That actually, your ovaries are still there, so they're still supplying your breast with estrogen. And so making sure you understand. And so Dr. Legree had talked about, Dr. Lakeysha had talked about earlier, kind of what cancers kind of correlate to your increased risk of breast cancer. And so one of the biggest one is not uterine cancer, it's ovarian cancer. And so if they leave your ovaries, but they do a myomectomy. So a myomectomy is when they take kind of a layer of your uterus out to stop you from bleeding. They're leaving in your ovaries, which is an increased risk for breast cancer. And so that estrogen production is going to increase your risk of breast cancer. A hysterectomy means they may only take your uterus. Well, if they leave your ovaries in, especially if you're young, they're going to leave your ovaries in because they don't want to put you in early menopause. That causes a whole list of other side effects. So you still got your ovaries. Guess what? Your risk stays the same. And so you got to make sure that because they don't take these things, you don't think, oh, hey, I had a hysterectomy at 35. I don't need to get a mammogram. That's not true. Nothing negates your risk of having breast cancer. And so making sure you are going and getting your proper screening at least once a year is what you should do. Period, point blank. So nothing's going to completely negate you from being able to do that kind of screening to making sure you have early detection, because that's what's going to save your life. Not you having a myomectomy, not you having a hysterectomy, but you getting proper screening. Yes, if you get a mastectomy and bilateral breast, that does decrease your risk. However, they're still going to want to screen you and make sure that you're doing what's proper, because guess what? You still got axilla lymph nodes that can get breast cancer. So you got to make sure you're still getting your screenings as appropriate.
Definitely. So ladies, man, this was so informational, and I had such a good time with you guys. Before we go though, I want to talk to the people about what annual screenings, both male and females, should people sort of put on their calendars as a thing to do. Don't everybody shout at once.
So the big ones, of course, for women, starting pretty early is your pap smear. So you want to make sure you're getting your pap smears, and the recommendation changes based off of your history as well as your age. And so it's normally every 2 to 5 years based off of that. So they do HPV testing and all of that. So you want to make sure you're getting your pap smear. The next thing is your mammogram. And if you watch the CAPE MD, again, that's the CAPE C4PEMD. We did a show a couple of weeks ago about colonoscopies. So pap smears, mammogram, then colonoscopy. Well, the new recommendation is that colonoscopies are done at 45, and that's not something that most people know. And so making sure you're getting that done. And then on top of that, if you're a male, especially a male who has a family history of prostate cancer, that you're getting screened for prostate cancer as well. And so those screenings kind of change based off of your age. And so you want to make sure you're doing everything you need to be doing to take care of yourself. One of the biggest questions I get is, well, my aunt had breast cancer, my mom had breast cancer. When should I get screening? Well, 9 times out of 10, it's 10 years before your parent or your aunt had breast cancer. So if they had breast cancer at 45, you should be screened at 35. And so making sure that you're being honest with your doctor, and also making sure you know your family history, is super important when you get some of the screening done.
Excellent. Well, man, it's 4 minutes to the hour, and this was packed with information. We can continue this for another hour, but we don't have the liberty. However, if you join us Thursday evenings at 8 p.m. Eastern Standard Time, is that right, ladies? 9, 8, something like that. But it's every Thursday at 9 p.m. Look, even I forget stuff. 9 p.m. Eastern Standard Time every Thursday evening on Facebook Live, ladies and gents, for an informational show about a healthcare topic. And we're going to continue this discussion on breast cancer next Thursday. That's next Thursday. I believe that's October the 8th. Where we will discuss breast cancer, and we'll actually have a breast cancer specialist to further answer some detailed questions. This Thursday, we're actually going to be talking about a topic that is near and dear to all of our hearts, which is domestic violence. Domestic violence, particularly in our community. Since COVID-19, the incidence has increased, sadly. So we're going to talk about domestic violence, and we're going to talk about the impact that it has in our community, as well as on our children. So thank you. That's all the time we have. Again, we are the CAPE MD. That's THEC, the number 4. We play off the letter A, the number 4, PEMD. You can find us on our YouTube channel, which is youtube.com/the CAPE C4PEMD. Please go to that YouTube channel. Please like, subscribe, and share. As you know, in order to deliver this information on mainstream television, which we're currently in discussions about, we need the support from our community and beyond. So helping us out would be fantastic. And any social media handles, you can find us at the CAPE MD. We also have a website where you can learn more about us individually and collectively. That's www.thecapec4PEMD.com. And we'll be having some e-commerce coming up during the month of November, you guys. So for your little girls out there who always want to be a physician, or even some of you ladies who are fabulous and melanated and keep the party moving like we do, we've got some items out there for you. So stay tuned. Thank you so much to Rolling Out. Thank you to Munson Steve. We love you so much. Thank you, Portia. Thank you, Ashley. And with that, we bid you adieu.
Thank you, guys.
Bye, everyone. Thank